I have been at the point where I didn't know where my next meal was going to come from.
Right.
You know.
While you're working.
Yeah, while I'm working.
Right.
You know.
Right.
And you think of the American dream, you don't think of that being it. And there's kids starving right near us. You know, within 10 miles of luxurious living.
Yeah, on the weekend when they don't get the school lunch.
Yeah.
Hello and welcome to our second episode of Living Room Politics. I'm Justin Pietro, candidate for the 9th District, and I'm here today with Sam, who's a Montgomery County local, and we're going to talk about healthcare and jobs and those type of things. So, Sam, go ahead and tell us a little bit about yourself.
I've been a mechanic for most of my adult life at various garages around the area. Been a volunteer firefighter, volunteer EMT.
How did you do with health insurance during those times and now?
Most of the garages I've worked at have provided health insurance. Recently, I've had more health problems and kind of gotten to see a little bit of the ins and outs of the healthcare system.
Yeah.
And some of it's good, some of it's not really good.
Okay.
But
so let's talk about the not good parts, the things that we can maybe work on if I get to Congress. So what are the things that sort of have maybe pissed you off, or things that you think could be fairer or better as you've gone through this?
Like in my job as a mechanic, if I don't fix your car, I don't, you don't have to pay for it.
Yeah, you don't get paid. Yeah.
But, I've been to a bunch of doctors and they don't really tell me anything, but I still get this astronomical bill even after insurance.
Right. And that's interesting. So you still have insurance, but
Yes.
the cost is still astronomical with the insurance.
Yes.
Okay. Yeah, because sometimes people talk about, if everyone's insured, that fixes the issue, but it's hardly a fix because there's still a ton of bills. And
we're no longer the people that are dependent on people. We're moving into
So it's like now we're like, we need, the healthcare is crazy, the taxes are crazy because now we're seeing it, right?
Yeah, it's no longer somebody else's issue.
Right. Yeah.
It starts it starts to affect you, then it's like,
when you get bills and your name's on it.
Yeah, and they're like, we're gonna start docking your pay and doing this and doing that, and I'm like, I already can't hardly survive, and then you're gonna take half my paycheck away,
Yeah, for insurance and stuff.
Yeah,
that's.
Then that affects, I can't make my car payment.
Right.
Because they're taking half my paycheck.
Right, and then you lose your car, and you can't get to work.
Or in my case, it's like tools. I have to provide my own tools.
Right.
I have tool payments,
Oh, really? You buy them on a schedule?
Yeah.
Okay.
And, if I don't have my tools, I can't make my money. So you take half of my paycheck away.
Right.
Then, it's kind of like I've always thought it was stupid. You send a child support violator to jail where he doesn't make any money.
Yeah, right.
To punish him for not paying.
Right. So do you have insurance on your own now, or is it through work?
It's through work.
Okay.
Yeah.
Okay. So a certain amount comes out of your paycheck every month. Then.
Yep.
Okay.
And I go with the highest coverage that my company, because they offer like 3 tiers. I go with the highest one that they offer.
Right.
And it's still astronomical after the when the bill finally comes.
Yeah, the bill still comes to you. Yeah.
I had an experience with a doctor that I went and more or less told me there was nothing wrong with my neck, and you go to 15 other doctors and finally get back to the fact there is something wrong with my neck. But I'm still getting charged for all those doctor visits in between. And I finally, I've actually said to the people, I'm paying for this. We've got to come to some sort of, I can't just keep running tests and
fix this. Yeah. So what do you still get, $200-$300 bills for each of those visits, right? It's crazy. Even after the insurance pays.
Yeah.
So now that you're going to have a procedure done. That's going to take a long time to recover, right? Mm-hmm. So how long do you think how long do you think it'll be till you can get back to working?
It'll be at least, 6 to 8 weeks
Okay,
before
that's a good long
I
time.
can get back to work.
And you work physically, right?
Yeah,
Mechanic, so
yeah,
you need to be able to move everything. You
yeah,
can't just sit at a desk, right?
yeah, exactly.
Yeah. So, and you can't just say, oh, I'm just going to get, paid time off or something because either you're in the shop or you're not, right?
Yeah.
So that's a big hit out of your life, out of your income. And,
Yeah.
Do you have savings that you're going to, what's going to help cover you
I
through
burned
that?
through it.
Yeah, that's what I figured. So just from the healthcare, you burnt through your savings. It
Yeah.
wasn't like you bought a boat or a
No.
sports car or something, right? It was
Yeah.
just basic healthcare stuff. So
Yeah.
So what would you like to see out of what's your sort of life goal? You want family, kids, job? Like what sort of makes you happy and would make you fulfilled living here in Montgomery County?
It's just that security, I have been at the point where I didn't know where my next meal was going to come from,
right.
So
While you're working.
yeah, while I'm working,
right.
And I don't think, you think of the American dream, you don't think of that being it.
Right, and right out of high school, you started working mechanic jobs and you learned the ropes.
Yeah.
I guess it took at least a couple months to learn all that stuff,
Yeah.
right? And you worked full time and you still had those crazy bills and burned through all your savings.
Mm-hmm.
Right, and that's just happening a lot, unfortunately, in the country now. It's like we don't even know.
It seems like to me, the majority of Americans in general are right there on that line where one major event can make or break them.
Right. Especially if it's a car.
Yeah.
If your car breaks down and suddenly you got, you need a new alternator. That's $400 or $500, and then what do you do the rest of the month? Yeah. There's a lot of people living that way. So and most of them who are working and they're trying to make it and they still can't.
Yeah. I can't remember the last time I really went on like a vacation.
Right.
Just because I feel like that's taken away from something else.
Just because you had the totally random bad luck of having some health issues, now you can't do the basic. Yeah. That's the story for a lot of people now because the costs are so crazy and out of control. So.